So what we're gonna do here is two different exercises. One is first an eccentric to work the hip flexors. This is I guess it would be a beginner or starting one for this. Just make sure that you're allowed to bring your hip back too far if you had an anterior hip replacement or just in general hip replacements. You don't want to do this too soon after that surgery. You want to make sure you have the strength and the control in the muscles. This is really more for just tightness. And eventually you would be able to, with those situations, just be at least a month out or so. So what we're gonna do here, keep this stable, basically everything on the table. And this would be your bed too. So I could, even if I put myself at an angle, I can use my elbows on both sides that way to anchor and stabilize. Keep your core engaged, keep your back flat. You want to control from the hip flexor as you lower down. Now this is a very common form of a stretch. A lot of people do just to stretch it out passively, but again, we want to train the muscle. We don't want it to be a parking brake that's engaged or disengaged. We want to train it to be a pedal brake to learn how to adjust like a dial between the two of being engaged and disengaged. So it's got to be under your control. It's not a passive stretch. So we're anchoring here, flattening that back, breathing, exhale with the lengthening. Imagine a balloon slowly letting the air out, and then bring it up. Now I could progress this to a straight leg. You're gonna have to adjust how you're gonna sit on the edge of the bed, make sure you're not gonna roll out. Could be do more here. I can kind of do more, lift it like I'm kicking a ball, bring it down, stabilize with that core. Don't want it to arch the back or pull on the back in any way. I'm just trying to control and lengthen these muscles here. I'm gonna follow that by working the muscles on the other side, the glutes. We're gonna do a modified bridge. So we're gonna start wide like this. So imagine you're simulating a squat or a sit to stand. In your seated position or squatting position, your knees are gonna be a little wider. My feet are neutral in line with my pelvis and where my hips would be here when I'm straight. But I'm starting with the knees wide. I'm gonna breathe in, anchor everything, core and all that. And when I breathe out, I'm gonna squeeze my glutes, keep my core engaged, and lift to drive through. But you always want to do the hip release first so that you're not working against that parking brake. So again, it's breathe in, breathe out, pull in, lift up, and work through that, which of course you can then progress into a seated version or a sit to stand version. And watch out for hamstring cramps. All right, good on that.